Is my vagina normal? Does my vagina need a makeover? These are the things that I've asked Cheri about off camera, of course. And these are the things that we're bringing to you to actually discuss and lay out on the table on the podcast. So I already gave you the beautiful intro. This woman is, I mean, when I said that she is the best of the best, I meant it. She is top surgeon in this area. I am absolutely blessed to know her. Cheri, thank you so much for jumping on the Thyroid Fixer podcast.
Amy, I'm so excited to be here. Thank you for inviting me.
Well, this is an important topic. And, you and I had lunch. We talked about this, and I asked you the very same questions I'm going to ask you today for my audience. But in having that discussion with you, I really realized, oh my gosh, this is not something that is talked about. It's kind of like, even nowadays, you and I think about talking about menopausal symptoms. Oh, yeah, we got the hot flashes. We got the dry vagina. Yeah, it sucks. Weight gain in the midsection. And we're very open about it because of the world that we live in. But you step out of our world into normal human being world out there, it's not talked about. You ask ladies, oh no, I don't talk about menopause. Like, we don't even talk about I don't talk to my friends about menopause. Well, they can't even talk about a hot flash. They're not talking about their vagina. And I think we have to. So that's why you're on today. We have to lay it all out there and know more about what can be done and what options are out there for ladies.
I love it. I love it. I think this is, as you said, very private. People are very embarrassed to sometimes talk about the normal things that happen. Menopause is a normal thing that happens to all of us. And yet we're still very hesitant to speak about it. And we talk to our girlfriends, like you and I can talk over lunch, but then we're looking over the table and see whether someone's listening to the conversation, right? So
Right.
I think it's really cool. I think women should have the ability and the confidence and the freedom to talk about things that are important because it affects our daily lives. And we think about it when we're sleeping. Why don't talk about it to our girlfriends and see what they're doing? Because if we do this, then we can get information how we can better ourselves.
Yep, exactly. And it's just like you said, people will get plastic surgery to improve upon a body part, whether it's breast implants or a facelift or a nose job. You're improving on that body part that you're like, maybe if this was just a little bit here and this was a little fuller there. And that's all this is. But it's so hush hush because, like, I came to you with the question, well, what are we looking for exactly to say that, hey, my vagina might need a little something, something, a little loving, a little plastic surgery love, just a little bit of a facelift. So let's start there. Can you tell me, what do you see in your practice? What's the main complaint? What do women come in saying, Dr. Ong, oh my gosh, can you please help me with this?
It's very interesting, the conversations that I get, because when they come to me, they've been thinking about it for a long time. This is not something that they just showed up. I'm going to speak about my vagina today. They've been thinking about it for years. Some of my patients have waited 10 years before they have the courage to pick up the phone and say, this, I don't know what's going on, but is it even a possibility? So I think a lot of them, when they come in, the words that they use is, things don't look the same down there that they were before. They're a little looser. That's a very common one. Is I've had kids, life, because you do life and things change. Like your skin gets looser in your face, it gets looser everywhere else, and the skin is looser down there. It just doesn't feel the same, just doesn't look the same. And then they bring up, is this normal? And that's one of the big questions that they have, is it normal? And that's where they usually start that conversation.
Yeah. And I guess, okay, there's so many different rabbit holes. There's so many different things going through my mind. I'm going to start here. Our view or our idea of normal, is that built upon, let's say, porn? Let's say really, porn is Instagram now. You can go on Instagram and see people's hoo-has halfway hanging out. Where do women get their idea of, we'll say, the perfect vagina look?
That's a good question. I think that with social media and with the porn industry, for sure, this ideal, right? So there is a lot of things that people think are ideal, but I just tell everyone, your vagina is normal. It's normal for you, right? And so that doesn't mean you can't improve on it. If your hair is curly, make it straight. You can do that if it makes you feel better about yourself. So I always start there. It's normal for you, but tell me about what you think you're not really happy with, or what do you think you're looking at and like you're not really feeling good about yourself. And if you start from that conversation, then they are in the mindset that there's nothing wrong with me. Things change, and there's nothing wrong in deciding if this is an option for you, if I want to do something about it. And that's where we start having that conversation, and they feel a little bit more relaxed, because we're not having a conversation about there is something wrong with you. Because just like everything else, vaginas come in different shapes and sizes, and that's who you are.
Mm-hmm. Yeah, exactly. And so you're just bringing women back to what they were used to, almost just like rewinding the clock a little bit, except for rewinding the clock on your vagina.
Yeah, exactly.
I love it. Okay. So the normal things to expect that a woman should expect going through childbirth. And I mean, a lot of the listeners are already going, I already know what to expect there. It gets ugly. But going through childbirth and then just going through the different hormonal changes in perimenopause and menopause. Can you get more detailed into what we can anticipate happens to our vagina during those times?
Just like every place in your body, you lose collagen with age. And so when you lose collagen in your face, you get laxity, which is loose skin, and things get looser. So specifically when we have hormonal changes, that's a big one. There's two things that really affect the vagina. One is hormonal changes, and the second one is loss of collagen. So when you go through big changes in your life, pregnancy is one of them. There's a ton of estrogen being pushed out during pregnancy. Your breast gets larger, and so things change with hormones. And when you hit menopause, then you have a lack of, as a better word, your hormone production decreases. When that happens, estrogen is a very important hormone, as you know, for our skin. And the skin of the outer labia is no different than the skin in your face. And so what women will feel is that now their skin is looser. And when they wear clothes, it hangs a little bit, and it doesn't look the same. Now, specifically for childbirth, there are certain things that happen when you actually deliver a baby, right? There's actually mechanical stretching and trauma that happens. And so what happens is that the vagina canal, the vaginal canal stretches out a little bit, and things may be looser down there. So what, as a result of that, there are two things that happen. One is a functional issue, where as you change with your hormonal changes, things may get a little dry. You may complain of vaginal dryness, or you may have leaky urine, cough, laugh, and sneeze, and then you have that urine incontinence. And then thirdly, they just don't like the way it looks. So I think we need to differentiate between aesthetics of the way it looks and then versus functional. How am I supposed to have sexual activity if I can't keep up with the moisture?
Now, will you see that? What age will you see? Because you mentioned that with pregnancy. After pregnancy, the vagina wall can stretch out and dryness can occur. Will you even have women in their 20s and 30s saying, hey, I have vaginal dryness and pain during intercourse already, and they haven't gone through that menopausal change yet?
Not as common, but the younger women have they usually come in for aesthetics, because genetically they may be born with, their inner labia being larger. One side is normally bigger than the other, or they're genetically larger and it feels really uncomfortable. So the women who are younger, as early as, true puberty, what happens is the labia minora, which is the inner labia, stretches and grows. And they don't like the way it looks because they can't do exercise the way they want. When they have sex, it's super uncomfortable, and they don't like the color, it gets really dark. And so these are the concerns that younger women would have even before menopause. So these are truly cosmetic considerations that they just don't like the way it looks.
Okay. And speaking of that younger crowd, now I'm thinking about my PCOS group, which I see a lot of. And
Mhm.
even, I mean, PCOS will even see into, perimenopause before menopause hits, the true androgen dominant ones. And I'm thinking of this because I'm also thinking about my days in bodybuilding where I'll never forget. I walked backstage and a friend of mine was giving a spray tan. And I remember thinking, wait, she only spray tans women. That's odd that she's spray tanning a man. And it wasn't a man. And I'm talking about my picture of the genitals. It was,
Yeah.
and that I was like, oh, wait a minute. I'm trying to make sense of that. So these poor women now, I mean, the bodybuilder, that's an extreme example, ladies. This is a lot of testosterone being used and abused. But what about my poor PCOS patients that they have this overproduction of androgens? Will they get what Karen Martell and I lovingly call a clitoris, but will they get an enlargement of the clitoral region?
Absolutely. No, it's
Oh,
funny you said that because one of the effects of testosterone and androgens is enlargement of the clitoris. Anatomically, when we were born, the clitoris is the penis, right? The head of the penis. And so that's how we were built when we were babies. Like the same thing that becomes the penis becomes the clitoris. And that's where we get all the sensitivity from. So when I see women and I examine them, I'll know those are the ones on testosterone therapy, as you said, increase androgens in their body, and they have a larger clitoris. Now, that is something that they would have to make a decision, obviously quality of life, etc., with testosterone replacement therapy that they choose to do versus PCOS, which is a medical condition where there's too much estrogen.
right.
And I think that counseling is important for them in terms of if we're going to do some improvement of the aesthetics, let's look at the whole picture and let's see how we can create a balance of what it would look like afterwards. Because what I want to do is make sure that everything's in balance. Because if I remove more tissue around that area, then your clitoris gets more prominent. And that's not what they want. So it's very important to have that conversation with them.
Right. So is that something that can be fixed? Can you actually shorten the clitoris to bring it back like to a smaller position, to a smaller look?
Yeah, so we can't really do much for the clitoral body because the important nerve endings and everything is in the body itself. So
Sure.
going into and reducing that body is going to be probably not the best way to think about it. But there's a lot of skin around the clitoris. This is what we call the clitoral hood. And the clitoral hood, we can actually, I've done a few procedures where we can either lift it or we what I call a clitoral pexy, where we actually pin and push back the clitoral body a little bit so it's not so prominent.
Yeah.
So there are ways to kind of allow that to kind of tuck in a little bit, so to speak.
Right. See, this is all
Yeah.
fascinating. This is fascinating. So
Yes.
the labia, it's interesting that you said that you worked with a patient who had, different sizes on each side. And I guess that's something that you don't really think about as a thing. But then when you say it, you're like, wait a minute, maybe I am a little bit lopsided. You start thinking about yourself and how you look and just the different anatomical changes. And that's so true when you really start to pay attention to just the changes that have gone on throughout the years. And especially, like you said, with hormonal changes.
Everyone
So much
is not,
fun.
symmetry is an illusion. My plastic surgery attending used to tell me the sisters, not twins, right? So right and left breast, the sisters, not twins, and labia is the same. Almost everyone, one side is bigger than the other. And so when women come to me, what they're looking for is they want smaller and they want more symmetrical. They want things straighter. So they don't want the inner labia flopping around. I just want it clean and straight. And so, we can create that during surgery. We can, remove more on one side versus the other and try to make it symmetrical as possible. And
Mhm.
then many women also don't like the dark edges at the edges getting dark. And so we will trim that out and make it look cleaner, but also by removing the dark edges, now things are a little, I like to call it like tucked in a little bit,
Yeah.
so it looks cleaner and it looks straighter.
That's just, I mean, I'm just blown away that you can do all this because we think of it as such a delicate area. And that's going to lead into my next question. Such a delicate area, but that, again, what I said in the beginning, not one that can be improved upon, but it can be just to up level your confidence. Now, one thing that comes to mind when you're talking about all this is recovery time. Now, I'm saying this because I want to give the audience an idea of recovery time, because I'm sure a lot of women are cringing right now and they can't imagine having any kind of surgery done on their vagina. But how bad is the recovery time? And I know you up level your patient's recovery with so many different tools that you have. So let's talk about the baseline recovery and then all the different things that you offer to really speed that up.
Recovery is the number one obstacle in any surgery. And so for me, I love that you asked that question, because first of all, I want to say something that I think is important. Most women are doing this for themselves. So it's they feel they're doing it for themselves. Never ever, as a plastic surgeon and a cosmetic surgeon, never ever do it for someone else. You need to do it for yourself. And in terms of recovery, it depends on how much surgery you do, right? So outer labia, inner labia hood, all of that. But roughly, the nice thing about this type of surgeries, at least the surgery I do, it can be done without general anesthetic. So I've really created a way that it can be done in the office. The nice thing about that is private. You don't have to go to hospital. You have to, risk of infections, things like that. And women having cosmetic surgery want to be, especially in this really intimate, highly sensitive area, they want to do it in the office. So it can be done in the local. Now, the recovery for something like that, if done correctly, you would be able to, walk. You don't have to have general anesthesia. You can actually walk the next day. You can move around. The biggest thing is swelling. So just like you have your tooth removed, like your mouth is going to be swollen. So in terms of recovery, some amount of discomfort over the couple days, and then we can talk about all the stuff we do to make that better. A couple days are going to be a little sore, and then no sex and nothing to your vagina for about 4 to 6 weeks. I think full recovery back to where it needs to be for the swelling and all that is about 3 months. But within a few days, you can basically walk, you can go back to work on a desk job, things like that. We just don't want women to exercise or do anything that increases the blood pressure and increase that swelling. So in terms of what we do, I truly understand that recovery is the number one obstacle for women having surgery. The first thing they are fearful about is obviously pain, because there's a lot of sensitive things and nerves down there. And then secondarily is how much downtime they have. And so when I approach a patient with having these type of surgeries, I prepare them before, during, and after surgery. So, for example, one of the things we can do is we can inject a long-acting numbing medicine that lasts for 72 hours instead of just a few hours. And that would take away the bulk of the discomfort in the first 24 to 40 hours, because that's when it hurts the most. And then we really hone in into the recovery. Icing is important. We do specific things in our practice that are a little different. So before surgery, I usually help. We do a lot of IV therapies, and we use the modalities of ozone and peptides and all those things to get people ready. And then we do it before and after. So in the before surgery part, you get them ready, get their bodies ready, tell them what the foods they need to stay away from, because one of the things that can happen after surgery is itching. So we keep them on a low histamine diet. We give them supplements to prepare for surgery. And then during the surgery, the specific things that I do is I use certain techniques to reduce the amount of swelling. So like most doctors or surgeons would use a knife in order to do the surgery, I use a very fine wire in order to do the surgery. That reduces less trauma to the surgical site and just allows things to heal faster. So there are specific things that we do during the surgery. And then after the surgery, we set them up with, IV therapies and things like that to speed it up. Certain creams that we also give them to speed up the healing process. And with this whole process, I'm able to bring down the recovery up to 50% better. And the faster they can recover, the faster they can get back to the kids, get back to their lives and move on. So that's, I think, a very big thing that I advocate for patients. In fact, this is something I want everyone to know about, because you can really impact your recovery.
Well, and when your patients are happy and they're recovering faster, I mean, not that you're going to have a whole lot of comparables, right? You're not going to have your neighbor Susie down the street being like, hey, it took me 11 months to recover from my vagina. You're not going to have talk about it, but you're going to know it. I mean, you're going to know in your own body when you tune into it, like, hey, this is really moving along faster than any other procedure I've ever had, whether you've had, something cosmetic done or knee surgery. You know how your body heals. And
Absolutely.
I'll tell you, when you have peptides on board, you can actually tell that you are healing at a faster rate. So I got to pick your brain here. What peptides do you like to use before, if you use any before, and definitely after surgery?
So we compound a peptide cream, and it is a copper peptide, an anti-inflammatory peptide. So we use GHKCU.
Mhm.
We compound with hyaluronic acid. So HA. So HA with hyaluronic acid is very widely absorbed into the body. So we compound that with GHKCU and then also BPC
Mm,
um,
yeah.
to help reduce the inflammation. But
Oh, that helps big time.
we also use exosomes in our. So after the surgery, I do inject exosomes into the area too, just to help with the speed up the healing process.
Talk about those. What are the benefits what are exosomes and what are the benefits of them?
So exosomes are growth factors that your body makes in order to heal an area. So when your body has an injury, surgery is one example of injury, there's trauma to the tissues. The body will secrete certain growth factors to help bring the stem cells in your body to help, recruit the stem cells to heal. So the exosomes are those signaling proteins that will call more stem cells to your area to help it heal. And so by harvesting your body's capacity, natural capacity to heal, but just build up that army. So now we're getting that army to go specific to the area and help reduce the inflammation and heal the area much, much quickly.
Oh, wow. That's fascinating. I've heard of exosomes being used like in direct injuries. If someone tears the MCL and they'll use exosomes in the knee, but I've never heard of it used post surgery for recovery, but it just makes sense to do it.
Mm-hmm. And the nice thing about the surgery that I do, is very minimal scarring. I think that's a big one too, because that area usually has blood flow, lots of good blood flow. Like if you do surgery in your upper lips, for example, because we're talking about the lower lips here, right? So the
Mhm.
upper lips, for example, like there's very little scarring because the blood flow is good. And so typically the area heals very well. We want to maximize that healing. And so there is very, very minimal scarring. There's no scarring because we're working on specific type of tissue. And so I like, I know you're a big proponent of estrogen replacement in your practice as well. And estrogen is one thing that area loves. And so we would also provide some estrogen support in terms of estrogen cream to the area to help the area heal faster. And so if your patients are on hormone replacement and they're having the surgery, that the body already has that estrogen, they're just going to do better. And
Yeah.
so that's one of the great effects, positive effects of estrogen that I love, because that tissue loves, loves, loves estrogen.
Well, and it's that whole holistic technique of addressing. You're not just going in and doing surgery. You're saying, how can we get your hormones balanced? How can we get you optimized so that you go into surgery a more, just your body in that more optimal state for healing? And then how do you come out the other side and speed things up? So I love all of this, all of it. Now you mentioned ozone and you said that you just got back from a conference, just diving deeper into ozone therapy. Tell us about that. Like, where does that fit in and what does it do?
So ozone is a medical gas, and there's so many things about ozone therapy. We use ozone a lot in our practice for, other things for health and longevity. But specifically what it does is that it really helps improve oxygen delivery to your tissues. And so by harnessing the effects of ozone before and after surgery, we can maximize the amount of oxygen that gets into your tissue. It also modulates the immune response, which I really, really like. And so modulation of the immune response just gets your cells ready to reduce the risk of infections, right? After surgery, we hardly, like almost zero infections in these types of surgeries. And so that is a big one. And before surgery, we get your body ready. I love that approach of you're not going to run a 100-meter race if you haven't prepared. So the outcomes that we usually get is how we get our bodies ready. And people don't really, that's the conversation I want to change with people. Whether you're having surgery with me or you're having knee replacement, like we can affect and control the factors to allow us to heal better. And
Yes.
so by harnessing your own body's capacity, let's get ready for that. Let's prepare your body. Let's reduce the stress that you have. Let's get your body and harness the environment. So now we can control and just allow your body to do its thing. And if we can affect the body that way, then it is amazing what it can do. So just allow your body. The worst thing you can do is walk into surgery highly stressed. In fact, I've said no to a lot of patients when they say, I want to have surgery in between this and that, and I'm trying to do so many things. I want to have surgery. Like your body doesn't have enough energy to do all those things. And you're a big proponent of the thyroid and adrenal. Like I'm a big proponent of the adrenals. The adrenals can only do so much. So if you're already stressed out in work and life, and then you want to push it a little bit more, having a major surgery, you're just not going to give yourself a chance in order to heal well. And then it takes time away. Instead of 2-3 weeks to heal, you take 6 weeks to heal, and then it just causes more problems than harm. But then good.
Oh, yeah. And you have to remember, too, that surgery is a stressor on the body, even if it's chosen. Right. So that stressor, if piled on top of you not taking care of your own shit, like if you're not dealing with trauma and the stress of your running yourself into the ground life, then that extra stressor might just be enough to push you into a deeper health condition. So that's the last thing that we want. We don't want autoimmune switches turning on left and right. We Absolutely. Want you optimized going in. So all of these things that Cheri does in her practice will get your body in tip-top shape. I mean, it just will. So from the ozone to the exosomes to the peptides, you had mentioned nutrition. I think it's important to say here too, because I want to hear it from you. There's only so much I can say on my podcast, or people are sick of hearing it from me. I want to hear it from you.
Yep.
How important is protein in the healing process?
Protein, you can hear it from me, and I'm a big proponent for giving your body the building blocks in order to heal, right? So protein is highly, highly, highly important for healing, and your body's going to need more protein. I was a trauma surgeon for a long time. Patients were really sick in the intensive care unit because they weren't getting enough protein. If you want the collagen remodeling, you want the building blocks of your tissue, that's where you need to take more protein. I have patients take more protein preparing for surgery and then after. So that's part of our support system for supplements, is that they need to eat real food, and they take building blocks for the collagen, and they need to build building blocks for all the things that help with healing, which is, vitamin C, increased collagen, and all the things that are important in the wound healing process. Because if you don't give your body enough juice, it's just not going to do well.
Right. Exactly. With any
Love
surgery,
it.
with any injury.
Any injury,
Right.
increase like 2 or 3 times the amount of protein that you need in order to heal.
So I'm still on the healing kind of aspect of things. What if people want to take their healing to another level post-surgery? And let's say they have an infrared sauna, they have a cold plunge, they have red light. Can they incorporate those things after surgery, or will they have to wait a little bit?
I love it. It's taking it to the next level now. We are ready to modulating all the different things in a higher level within ourselves in order to do the things that are just inherent in terms of healing. So you talk about infrared. So infrared activating, reducing inflammation, activating the mitochondria is going to be, that's a powerhouse of your cell. So if we can give energy to that mitochondria, whichever way, preparing the body for that will be great. So not immediately after surgery, but once the surgery is done, then I highly encourage things like infrared sauna, and things that will reduce inflammation. Now, if you've decided that you wanted to get surgery, there's certain things that you can do before in order to prepare yourself. So one of the great things about sauna therapy is a detox, right? So if you are not, you have lots of stuff in your body, whether it's toxin, heavy metals, just a lot of stuff going on. If you're not detoxing your body enough, then it's already going into surgery 50%. And now you're stressing the body more. So detox is great way after surgery, even 3 months, 6 months before surgery. And that's good for health anyway. Why wouldn't you do the same things that you do for your health? The same thing, like if you're going to a stressful situation, if you can get your body prepared for anything that happens, whether it's surgery or you decide not to have unplanned surgery, you go skiing, you break your leg, you're already halfway there. So anything that we're doing in terms of our health is just going to get us better and better set up to any kind of stressor that we have in our lives. And surgery is just one of them.
Love it. Love it. So we walked all the way down the path of pre-surgery, during the surgery, post-surgery, recovery, biohacking, things that you can do. Now I'm coming back to the beginning.
Okay.
Back to the women making this decision. So now we've captured their attention. Now they're actually thinking about things that they've never thought about before. I'm speaking from experience, right? Because me having this conversation with you, I'm like, I'm starting to think about things that I've never thought about before, like the look of everything down there. So now you have women thinking about it. What are their next steps? Like, what information should they process through? What are their next steps? I know that you're offering a call with you, but take women through what you have seen in your practice, the thoughts, the feelings, the emotions, the conversations they have to have with their loved one, their significant other. What is that?
Yes. So first things first, usually women have thought about it for a long time, as I said.
Yeah.
And I think it's super important that we have this conversation that the guys don't really care. Like, honestly, the guys don't really care what it looks like. And we can make some jokes about that, but truly the guys
I know.
are just happy that they have, a wonderful relationship and they are able to have sex with someone, right? So the power is that. Now, a lot of things that women are thinking about in the surgery, like, first of all, they may be thinking about how they feel uncomfortable and how it's affecting their self-confidence. But again, they may not know what's going on. So, and then they see a lot of stuff online. So I think online is a big place where people try to look at different things. And people may be thinking about this for months or years, but they're just not sure. So I think the first thing when you think about, well, is this normal or not? I'm just not really comfortable what I look like. I think it's just good to really find someone like me, or someone that's spoken to a lot of women, to just have a conversation. And that's why I have discovery calls with everyone. And I turn away 20% of women. They call and they say, I want to have the surgery. I said, well, is this going to solve your life problems? No, you just, the other things that need to be put in place. I think is very important, because there's so much of our emotions as women that are centered around the vagina and how we feel about ourselves based on what it means to us. So just having a conversation, and it's not about, hey, I want to make my breast bigger, let's put a breast implant. I think for this conversation, I usually spend a lot more time with them, because it's a deeper conversation. What is the reasons they want to have that? Some people honestly have a great relationship with their partners and just want things to get better, and those are the people that we can kind of fast track to. Some people may need some therapy. They need to talk to the therapist of why they may have sexual trauma in the past, or they had a bad experience with someone, or a guy said something and it just stuck in their heads for a long time. So I think people come at different times in their life thinking about the surgery, just really understanding what it's doing. And the question I ask every woman to think about is this going to be the one thing that would be the catalyst improving your life? Or is there something else that you need to do that? Because surgery is not going to fix your relationship issues. Surgery is not going to fix what you think about yourself. And just, I think if you can get support and clarity around that, then surgery can be very, very powerful, because it is a physical transformation, and a physical transformation for the positive. And they can, by looking different and feeling better of themselves, then they can actually show up in life and walk a little taller, and and be able to feel their worth, their self-worth even more, and can be powerful. So I think there's a lot of things that need to be ironed out before that conversation, but it is very, very, very powerful.
I love it. I agree. I agree. And I think this is one that you need to be having with your friends, because once you start talking about it, other people start talking about it, or have
Yes.
it with me, or have it with Cheri. I mean, have the conversation. Don't bottle it up inside, because it's something that we now have the tools and wonderful people that are highly skilled to do this, to help us out in this journey. It's just one more option that we have as women. Thank God, in the medical system, it's one option that we have. It's a power that we have, that we can take control over our bodies and make a choice to give something a facelift if we want to give it a facelift. I don't care if it's your face or your vagina. You do you, and do the things that are going to make you feel confident. I'm a huge proponent of that. Huge.
Yeah, and I also agree that this is not something you want to take lightly,
Mhm.
because you what I've seen also is people rushing into it, where
Mm.
they're like, oh, okay, I've decided I don't like the way it looks. I'm just going to go to a place, I'm just going to get it removed, and then something bad happens, right?
Yeah.
So now the negative consequences of that is even worse. I've had patients who had what we call botched surgery, where they went to someone maybe less qualified, or they just, and then something bad happens, and now instead of where they are, they've gone backwards, and so they're so, I hate to use the word shame, but it is truly, they're very, very uncomfortable, and now they don't even feel comfortable having sex, or they need to have the lights turn off because they don't feel good of someone looking there. So I think that it is a very serious thing, is not having something like a hair removal. Your hair would grow back, your labia is not going to grow back if someone did surgery on you. So I take this very seriously. It's just my responsibility to really educate women about, like, why they're having the surgery, and really taking the time to find the right surgeon for you, because things could go wrong and then it becomes a bigger problem.
Yes. So it's the right. I'm very happy you mentioned that, because I was thinking, I didn't even think about botched, but
Yeah.
that's true. I'm sure there have been, just like women go, down to Mexico to get a boob job. Not the best decision in the world. You're going to have issues. So, and you're going to spend more money getting it fixed than if you
Exactly.
just invested that money, that investment in yourself, with someone that is good, top level, and like yourself, that has a whole repertoire program for you to heal faster. And that's ultimately the end goal, is to
Yeah.
heal the best you possibly can and the quickest you possibly can to get back to your life.
Yeah, it's not a hairstyle change.
Yeah, exactly. No, it's not. No, it's not.
It's permanent. Yeah.
It is permanent, but it can be a beautiful permanent solution for many,
Right.
many women.
Major transformative experience. Yes.
Yeah. Yeah,
Yeah.
absolutely. Well, Sri, thank you so much for coming on. Can you tell people where they can find you, where they can book your discovery call so they can have this conversation with you? Tell us all the things about where we can find you.
So my practice is called the Ong Institute. They can go to www.onginstitute.com, fill out a form, and I'm happy. We have an assessment. So I have patients fill out assessment, and then I give a free 15-minute discovery call, just making sure that we are the right place for you. And it's, I want to make sure I speak to all of my patients, making sure that this is the right thing for them and with the right place for them. So having a conversation with me, and then if this makes sense, then we take you to the next step, where we actually do a full consult. We dive deep into your medical history and a little bit more yourself, and they become a patient, and then we guide them through the process. So the first place is, taking that phone call and finding time to have a conversation with me. And we also have a lot of information that we can give to patients, even they're thinking about it, to get them start thinking about the process, what it means in terms of recovery. So we have a surgical guide that we created that we can give to them, and they can just read about it. And I think just better prepared you are, the better you will be.
Oh, 100%. And you're in beautiful Scottsdale, Arizona. So not a bad place to come visit, and not a bad place to have surgery and recover there for a little bit too. So not going to
Yes.
complain about the location. It's gorgeous.
Yeah, no, Scottsdale is great, especially this time of the year. The next 3 months will be amazing.
Absolutely. So we'll put all of your links in the show notes so people can easily click and book with
Yeah.
you. But
Thank
just
you.
a big personal thank you for taking your time today. I know you're super busy. You're in scrubs, for goodness sake. So we're pulling you away from your day. But this is just a topic. It's a message that I'm very passionate about sharing with my audience, because I know it's not talked about enough, but it's deep on women's minds and hearts. So I thank you from the bottom of my heart for your time today.
Amy, thank you. I'm glad to have this conversation with you and your audience.
Thanks, Cheri.
You are welcome.